Did you just get your semen analysis results and feel completely lost trying to read it? Well, let's break it down. What each number means, what's normal, and what it really means for your fertility goals. Number one is the semen volume, or the total amount of liquid collected in the sample. A normal semen volume is at least 1.5 milliliters. Anything less than that can indicate a few different problems. One potential problem is an obstruction of the ejaculatory ducts, which are the holes the semen travels through as it enters the urethra. Another potential problem is called retrograde ejaculation. This is where the semen travels backwards into the bladder instead of coming out of the penis. Retrograde ejaculation can be caused by medications as well as conditions like diabetes. The good news is both of these conditions can potentially be fixed. As long as you're producing sperm, there's usually a way to retrieve it, even if these conditions exist. The next number to look at is the sperm concentration, or the number of sperm per milliliter of semen. You want at least 16 million sperm per milliliter. And next is the total sperm count. You want at least 39 million total sperm per sample. The next is motility. This is the percentage of sperm that are capable of swimming to the egg. We want at least 40% of your sperm to be motile. You may also see mention of something called progressive motility. Progressive motility indicates that the sperm not only move, but they move forward in the direction they need to go. You want this to be at least around 30% or better. When I'm evaluating a couple that's trying to achieve natural conception, the most important number I'm looking for is the total motile count. You need at least 15 million total motile sperm to achieve natural conception. Anything above that, you theoretically should be able to achieve natural conception. Below that, it's going to be very difficult. So when I know a couple is trying to achieve natural conception, that's typically where my eyes go to first. I make sure that number is over 15 million. If you're doing IVF, this number is a lot less important because you need very few sperm, and it doesn't matter if the sperm can swim or not. If you're trying to do IUI, or intrauterine insemination, you want at least 10 million total motile sperm, but you can collect multiple samples to use for IUI. Another special test that's commonly ordered, particularly for patients doing IVF, is called morphology. Morphology refers to the shape of the heads and the tails of the sperm. Previous studies have not shown a correlation between morphology and the success of natural conception. So this test is mostly important for patients doing IVF. Another important test that I don't commonly see ordered outside of andrology clinics is called DNA fragmentation, or DNA damage. This test looks at the health of the DNA in the sperm. The reason this is important is a high DNA fragmentation can increase the risk of miscarriage or spontaneous abortion, and also decrease the success of conception. DNA fragmentation is usually checked if a man has been involved in multiple pregnancies resulting in miscarriage in the past. A healthy range for DNA fragmentation is below around 25%. So semen analysis can be a pretty complex test. But to recap the most important parameters, you want a volume of at least 1.5 milliliters of semen. You want a concentration of at least 16 million sperm per milliliter of semen. You want a total sperm count of at least 39 million, and you want a motility of at least 40% motile sperm. If you're trying to do IVF, you want at least 4% normal forms on the morphology. If there's any history of miscarriage, you want to look at the DNA fragmentation, which should be below around 25%. The causes of male infertility can be pretty complex as well. So if any of these numbers are out of range, you need to see a professional that specializes in male infertility to at least get a physical exam, collect some blood work, and collect a detailed history to try to identify any potential causes of the abnormalities. In the meantime, I hope this helps you to make more sense of your results. If any of these numbers are looking a little lackluster, the good news is there's a lot of things you can do on your own to improve your fertility. Be sure to check out my next video where I'm going to cover the different lifestyle factors you can address to improve your fertility today. Be sure to follow Strong and Hard for more evidence-based content on fitness and men's health. Get strong, stay hard.